But first, yesterday we told you about that disturbing investigation by USA Today about the dangers of, quote, medical tourism in Florida. People from all across the country are flying to Florida. They're trying to get discount plastic surgery. What many of these people don't realize, these surgeries are often being booked by non-doctors at clinics owned by convicted felons. And dozens of people have been critically injured, even killed by these surgeries. And it's all because of a loophole in Florida law. Did you know felons can't own pawn shops, but they can operate surgery centers? How? I'm joined by Dave Ehrenberg. He is the state attorney for Palm Beach County who's trying to curb this practice. Also, Dr. Anthony Yoon. He's a board-certified plastic surgeon. Gentlemen, thank you for being with me. Dave, I've got to start with you. How is this a loophole, and why have lawmakers failed 4 times to change this?
It's crazy, isn't it? You know, there's an old saying that Florida is a state with the population of New York with the legislature of Alabama. And that goes to the fact that Florida doesn't like a lot of regulation. They say less government is best. But in this case, it's impacting lives. You have 13 deaths and 12 serious injuries from these surgery centers, cosmetic surgery centers, where ex-felons are allowed to own and operate these places. Now, when the legislature first started to license these facilities, they believed that doctors would be the ones owning and operating them. But then in recent years, you had private investors come in, some of them ex-felons, and they are really unregulated. They're not covered under the same Board of Medicine rules. And so this is a real gap in the law that needs to be addressed.
So if it's not going to be addressed by lawmakers, what do people need to know? Dr. Yoon, in some of these cases, patients are being sold a surgery over the phone by a telemarketer, a salesman. So what do you need to ask if you are going into one of these centers?
Well, the important thing is that to understand that plastic surgery is the wild west of medicine, and there are doctors out there performing cosmetic procedures who are woefully not trained in it. They're not board-certified plastic surgeons. They're not members of the Aesthetic Society. So if you're a patient and you're thinking about a cosmetic procedure, this is not a place to save money. You do get what you pay for when you're thinking about plastic surgery.
And, you know, Dave, what rights do these patients have? You talk about how difficult it is to prosecute the centers because these people don't have medical license, and that's legal.
Yeah, it's okay for an ex-felon to own these facilities. Now, there is a bill pending, Senate Bill 732, that looks like it may pass this session, but they've watered it down, and it doesn't affect the whole ability of ex-felons to own these places. So if it's up to a prosecutor, we would have to prove a high standard beyond a reasonable doubt that culpable negligence existed, which is a gross and utter disregard for the safety of others. It's a high burden to reach. Most of these cases are dealt with in civil court as far as malpractice lawsuits. It's very different than the higher burden that a prosecutor would have to reach in criminal court. But if someone dies and we can prove culpable negligence, you could get a second-degree felony punishable by up to 15 years in prison. But I haven't seen any cases like that under Florida law.
And, you know, Dr. Yoon, when it comes to some of the red flags, you say don't try to have a discount. What are some other things we should look for when it comes to potentially dangerous centers?
Well, very important. If you're going to consider plastic surgery, you want to meet with the plastic surgeon before your surgery, not the day of your surgery, not an hour before. You need to undergo a real consultation. And if the doctor is too busy to spend a half hour discussing your surgery with you, then don't pick that doctor.
I like some of your recommendations is don't go for the person that's trying to upsell you. You go in for a tummy tuck, and if they're trying to push 15 other procedures on you, probably a red flag. Dave, why not just shut down these centers? Why just cite them, as in many cases is done?
Well, to cite them, you would have to go under Florida law, and you can do that by fining them and citing them. But as far as shutting them down, there are property interests at stake, and there are arguably no crimes occurring because the laws are relatively weak and unclear. And so that's why reform needs to happen. And the bill that's currently pending in the state legislature doesn't go far enough. I mean, it's a step in the right direction. But it all goes back to the anti-regulatory bent of this Florida legislature, where they believe that less regulation is better. But in this case, it has impacted lives. We're talking about 13 women who have died, and the people who are being targeted here are people from the Bahamas and other minorities who can't afford the higher end medical care. And I leave you with one other thing. Florida actually is promoting this. Florida has spent millions of dollars promoting medical tourism around the world for people to come to these surgery centers and get their procedures done. So it looks like that the state doesn't have the incentive to get tough on something that they're actively promoting.
It all comes down to money, as it often does. Dave Ehrenberg, Dr. Anthony Ewan, thank you so much for being with us. And if you want my take, here's the simple truth. If you want to save a buck, cut coupons for toilet paper. Story after story reminds us under the knife is not the place to get a deal. Do you remember the Georgia dancing doctor? She's advertised as a dermatologist, then she upsold people on sneaking in a tummy tuck or a facelift, and it led to infection, disfigurement, even brain damage in some cases. Her dancing videos went viral, and it was because she was making a promo spot using a patient who'd won a contest for free services. Now, in 2018, her license was suspended, but for just 2.5 years. Did you know that Georgia law allows doctors who are licensed in the state to practice medicine and perform surgery regardless of their specialty? So you can be a dermatologist and do my tummy tuck outside of a hospital in a spa-like setting. In Florida, it's convicted felons who can run a surgery center, and we've seen what that leads to. Know your state laws here. According to the Journal of Medicine in 2012, only 21 states require the accreditation or licensing of offices where doctors perform these surgeries. And in most cases, deep discounts are marketed to lower income people, and that's when the bad stuff starts to happen. And we've all heard the horror stories of other people going outside of the U.S. to save money. Do you remember Laura Avila? She traveled from Dallas, Texas to Mexico for surgery and died after her family says anesthesia was done incorrectly. It left her with severe brain damage. An entire show was created based on this problem. Botched.
There was a doctor in Mexico, and it was going to be like maybe half the cost. I pretty much was like, okay, this is the end of the road for me. I can't believe I came to Mexico to die. I only have the upper part of my chest.
Okay, so you have Poland syndrome.
I never had that.
So doctors want to remind you, while some plastic surgeons do advertise, the number of ads is usually related to the quality of the doctor. The more ads you see, the less quality you're going to get in most cases. Coupon clipping is for your groceries, not your body. That's the simple truth.